Hello and welcome to breastfeeding. We will be covering all sorts of good information on getting started and pumping and going back to work, things like that. So welcome. All right, babies should be breastfed or receive express human milk exclusively for the 6 months of life or longer. This is what the American Academy of Pediatrics recommends. In fact, they recommend breastfeeding for at least a year. Up to 2 years is completely okay with them. Solid foods could be introduced anytime after that 6-month period, all the way up to their first birthday.
So we're going to start out tonight by looking at just the anatomy of the breast. It's often kind of a confusing thing to wonder how that all is produced and happens and things like that. So if you just look at the yellow portions of the breast tissue there, that is fatty tissue, and that would be contributing to the size of a breast. Kind of a common misnomer out there is that if your breast is small, then you must not be able to make a lot of milk. And in fact, that is not the case. Breast size has no impact on how much milk you make. So if there's a supply challenge happening, it's likely related to something else that we'll cover later on. And then you'll see those kind of oval shaped, kind of bumpy looking pink things. Those are the mammary glands, and that's where that milk is going to be produced. And kind of take note of where those are located in the breast, kind of that they're not right at the nipple, but they're a little further back. That will be important when we talk about baby having a deep latch. We want baby's mouth to have as much breast tissue in it as possible to really work and massage those ducts, because that sucking action is going to be what tells your body to let down the milk. And at that point, the milk will come from those mammary glands down through the milk ducts, which are kind of like a straw, and that leads to your nipple. And if you'll notice, you have multiple milk ducts, which means there are multiple holes in your nipple. And many people don't realize that when baby sucks, they get milk out of multiple places until the first time they pump. And then they're thinking, whoa, it's like a broken shower head, right? Milk coming out all over the place. So just be mindful that that is the case, and that's completely normal. And the last one on there is the areola, and you cannot really see it on this picture very well, but it would just be the darkened circle around your nipple. And we'll talk about the importance again of that part being in your baby's mouth while you are getting a good latch.
So your body is getting ready during your pregnancy. You'll notice that your areola is probably getting a lot darker. Your breast size has probably increased, and that varies from person to person. Some people notice the increase right away, and some people don't. Some moms, you're not going to notice that until later on in your pregnancy. If you are fair-skinned, you might notice a bluish tint to the skin around your breast tissue and your chest wall. That's increased circulation and blood flow to help with the growth of your baby and also getting your body ready to produce that milk. If you have darker skin, you might not notice it quite as much, but you might notice some veins and stuff kind of raised on your chest wall. That's completely normal.
And just like your body is getting ready, so is baby. Baby is doing a lot of things in the womb right now, practicing all those things to coordinate that suck, swallow, breathe. Maybe you've had an ultrasound lately or at some point in your pregnancy and the technician has said, oh, look, baby's sucking its thumb or baby is swallowing. And that is exactly what we want to see. We want to see baby practicing that skill. Babies often prefer circles to squares, and they prefer, or they like that contrast, the light versus dark. So think back to that image of the anatomy with the breast tissue there and the areola being a circle, and that it darkens when you get pregnant. It kind of helps baby, kind of bullseye for baby when they're looking for your breast to get their milk when they're first born. And then lastly, that they know their mother's smell. That amniotic fluid that baby is currently surrounded by right now in your belly smells a lot like your breast milk. So when baby is born and they put baby up to your chest, that helps baby to really make that quick association between mom and your milk and the comfort that they had in utero, and now the comfort that they will get from mom and from mom's milk. So kind of a neat connection there.
So colostrum is that first milk that you'll notice right after baby is born. You might even notice some of leaking in your breast later on in your pregnancy, and it's thick, yellowish looking liquid. It usually is around for about that first 48 to 72 hours after baby is born. That's what they'll be ingesting first. And that gives your baby months and months of great antibodies and protections into their system. Their intestines are kind of like a sponge, and that coats that spongy lining, and that's what provides all that goodness to the baby.
So your milk is made perfectly for your child. Depending on your baby's situation, if they're born early or late or different needs they have, your body will adjust your milk's contents and all kinds of things to make it just right for what your baby needs to grow best. Your milk is always clean. It's always the right temperature. Babies who are exclusively breastfed tend to have what we would consider more caregiver-friendly stools. They go often. They have a lot of poopy diapers when they're breastfed exclusively, but it typically isn't as potent, if you will, when you're changing the diaper. So a benefit to that too. And then the milk has some natural tranquilizing properties to it too. So when baby is breastfeeding, they typically get really sleepy, which is hard because we want them alert and actively sucking. But it does keep them kind of calm, and you might have heard people say, oh, they're in a milk coma. It can be a good time to do things like clip their nails, things like that, but they will get very, very relaxed just from being at the breast.
So that first week, after about that 48 to 72 hours, your colostrum will start to switch over to milk. Baby suckling stimulates your milk production, so the more you bring baby to breast and the more you allow them to nurse, the more milk you usually make. That milk comes in about 3 to 4 days postpartum, which is right after you get home and you don't really have those nurses to call on to help. So just be aware of that. Your breasts are probably going to leak. They're going to feel really full with some engorgement. You can relieve that by taking warm washcloths and kind of wrapping them around your breast to soften everything up. Maybe hand express a little milk just to sort of relieve some of that discomfort. You'll also notice that baby's going to be swallowing more and possibly even choking a little bit, not serious choking, but just kind of gagging because the milk might come out really fast. Just take them off the breast, let them catch their breath, and then you can go ahead and put them right back on again. They should be fine. People are always concerned about the amount of milk that they're producing. Just keep in mind that baby stomachs are really small at first. That diagram at the bottom on day 1, baby stomach is about the size of a cherry. And by the time they're 1 month old, it's about the size of a large egg. So keep that in mind, that they get full really fast, but then it also empties out really fast. And so you're probably going to need to feed them more frequently. It's not that you're not necessarily making enough, they just eat very often for those first few weeks.
There are lots and lots of benefits to breastfeeding your baby. Typically, they'll have less spit up, gas, diarrhea, constipation. Again, because it is made perfectly for them, it typically is perfect for them to digest. They have a stronger immune system from all that goodness that's in there, those live cells and things. Their vision is great. There's extra high fatty acids and things in the milk that can contribute to better vision and brain development. And then lastly, it lowers the risk of sudden infant death syndrome. And this has to do with the recommendation of babies under 6 months being in the same room as their moms, and while they're sleeping, not in the same bed, but in the same room. And because of that, it kind of syncs up moms and babies' sleep cycles. So mom is more in tune to babies waking or sounds and needing to feed and things like that, and baby's not slipping into that deep, deep sleep. Mom has that opportunity to pay closer attention and be more aware of things too. So definitely a good benefit.
Breastfed babies are also fit for life. They tend to have fewer allergies, eczema, asthma. It also can lower the risks of leukemia, diabetes, and heart disease. Again, it's all the nutrients and things that are found in breast milk that formula can mimic, but it's not quite the same. So just another side benefit of breastfeeding. They're also less likely to become obese as adults, and that goes back to it's very hard to latch on a baby who is full to the breast like it is maybe to feed them a bottle and kind of coax them into eating that last little bit of the bottle because it just flows out a little bit better. So babies who are breastfed tend to listen to their own hunger cues and their feeling of fullness, and that carries over into adulthood.
Lots of benefits here for mom too. Mom typically has less postpartum bleeding, which in connection to that would be that she also has a lower risk of anemia. Mom gets a higher caloric intake allowance, if you will. Surprisingly, it takes a little bit more calories to make milk than even when you are pregnant to just grow a baby. So good, healthy hearty snacks are going to be helpful. Your breastfeeding produces naturally soothing hormones for you too, mom. It lessens the risk of osteoporosis and lowers the risk of those cancers, breast, ovarian, and uterine. And the reason for that is because the fewer times you have your menstrual cycle, the lower your risk is. And typically, as the last point says there, when you are breastfeeding, your menstruation is delayed. A little side note on that, keep in mind that you do ovulate before you have your period. So just because you haven't had a cycle yet, or that you know of, you haven't menstruated yet, doesn't mean that your body has not resumed that cycle and you haven't already released an egg. So it is not birth control by any means. So keep that in mind when you are postpartum and thinking about, delaying another child or not. Just that because you haven't gotten your period doesn't mean that you are not capable of getting pregnant again.
So partners are nurturing too. I know partners tend to feel a little left out because breastfeeding requires mom's almost unwavering attention to the baby. So partners, how you can help is taking care of mom. Help with that breastfeeding routine. When she is nursing the baby, make sure she has water and snacks, and maybe pick up some of the household duties for her that she would normally do. If she's normally one that does the laundry, maybe it's time for you to step up and take care of that. Or she mows the lawn, so go ahead and take over that job for her for a while. You're going to develop your own unique and special bond with the baby. Everybody that comes into that baby's life is going to have their own special bond, and it takes a village to raise a child. That's really true. We want kids to experience all sorts of different people in their lives. If you want to help with the feeding routine, we strongly encourage you to wait about 3 to 4 weeks before you introduce a bottle to the baby. They can get what we call nipple confusion, and it can make the breastfeeding journey a little more difficult, and it can also affect your supply sometimes. So just be aware of that if you're going to introduce that bottle, you might want to wait a little bit.
Imagine the baby's birth from their point of view. We often kind of jump ahead to just, assuming that baby's born and they should just kind of settle into a routine and just be kind of perfectly adjusted. When in fact, the whole time they're in your bed in your belly, they've never been hungry, they've never been cold, the lighting is perfect, they've always been comfortable. And so now you kind of toss them out into this world where it's cold, bright, noisy. It can be a painful transition. So we like to remind people that to kind of consider those first 12 weeks of baby's life as really like the 4th trimester of pregnancy, because that puts a better spin on their baby's needs and why they're so needy, if you will, those first 2 weeks. The best thing you can do to help with that transition is to bring baby back to mom. Remember, mom's breast milk smells like the amniotic fluid, so that comfort that they had all 10 months inside your belly is going to be brought back quickly and help with that transition to the world if they're with mom. So the less time that you're apart from baby mom, the better.
So we want you to get off to a good start as much as possible. So right after the birth of the baby is when they are most alert. So after baby's born and everybody kind of clears out of the room for a little bit, you have about 2 hours in that labor room. And that's a good time to initiate breastfeeding, try some skin-to-skin contact, allow the baby to touch the breast, taste the colostrum, attempt to latch. The nurses will help you with that. Right now, with COVID and some of the restrictions that the hospital has, you're going to be limited on visitors anyway, but we strongly encourage you, if that does change, to limit visitors till maybe after you get into your recovery room, which is usually about 2 to 3 hours after baby's born. And that's maybe a good time to have visitors start coming. We just want you to get that initial bonding time with baby and kind of be selfish about it and take that time to start off with the breastfeeding experience.
There are a lot of benefits to skin, both physically and mentally. For one thing, we'll talk in a little while about the importance of watching for these feeding cues. Those are signs that baby's telling you that they're ready to eat. And if baby is with you, mom, you're going to notice those cues a lot more quickly. Having baby skin to skin with you is going to help increase your milk production. So that goes for, immediately after birth, you put baby on your chest. That's going to tell your body it's time to start making that milk. And then that goes for even weeks afterwards. If you feel like your, supply is maybe starting to not be what it was, put baby to your chest and do a lot more skin to skin time, and that will tell your body to kind of kick it up a notch too. Skin to skin decreases crying and provides that comfort. Again, they're comfortable with mom. That's who they've been with for 10 months already. And then physically, it does really miraculous things, like it regulates baby's heart rate, temperature, blood sugars. So if baby comes out and their temperature is maybe not right where the doctors would like it to be, they'll set baby on mom's chest and mom's body will actually raise or lower her temperature to make babies what it should be. So just really, really awesome. The ability that your body can do that to help that transition be more smooth for baby. And then, of course, it helps with bonding. And so keep in mind, moms, that it doesn't just have to be you to do the skin to skin. That will obviously be important for the milk production. But as far as the bonding goes, support people in the home too, whether it's in the hospital or once you're at home. Definitely take advantage of that skin to skin time. Take your shirt off and put baby to the chest. They really do well there.
So we'd like you to have a few places in your house where you create a nursery nest. It's basically an area where you sort of gather all the supplies you think you're going to need for baby into one area so that when you get settled down on, say, your couch and get all comfortable, you realize, oh, I forgot, whatever item it is, and you don't have to go searching for it. If you have a one-level house, you might only need one nursery nest. If you have a multi-level house, you might want to create one on each floor. Totally up to you and whatever your comfort is. We'd like you to have pillows or a boppy or some kind of, breastfeeding pillow item that you can buy. There's all different kinds on the market to help prop baby up and get that baby up to your level. We want you to be comfortable, so you get comfortable and then kind of prop baby up to keep it that way and bring them up to your level. Have water and snacks on hand. Breastfeeding, again, takes a lot of calories and you tend to get really thirsty once you're nursing, so keep water and snacks on hand. Reading material, your remote, your phone, kind of a nice quiet time once you get baby latched on for you to relax a little bit and maybe catch up on the news, the weather, a good book, something like that. Nursing pads, you're going to want some kind of nursing pad. They make washable ones and disposable ones. They're great to put inside your bra, especially when you're going out and about. Sometimes you leak a little bit of milk and you don't want to really leak through your clothing so that people notice that you're leaking. And when baby's nursing on one side, you tend to leak out the other side, especially at first until your supply and demand kind of gets evened out. So have some nursing pads on hand. Diapering supplies, wipes, diapers, ointment if they have a little bit of a rash, something like that. A nail file, burp cloths, receiving blankets, whatever you think you need for your baby. Just keep it in a basket, a bin, a laundry basket. It doesn't have to be anything fancy, but keep all those supplies on hand to make your life a little easier.
They have come out with a lot of different clothing options to make breastfeeding a little bit more convenient. You can see the lady is demonstrating how a nursing bra would work. So it looks like a normal bra, typically more comfortable. They don't normally put underwires in nursing bras because those can cause clogged ducts and things like that. So typically a pretty comfortable fit. And then the difference is just that up 2 shoulders, there's a little clasp and you can open that and expose one breast. And then when you finish feeding, switch to the other side and expose the other. Many people really enjoy having the nursing tank, which is the black one there. Those are exactly the same how they work, where they have that closure up on the shoulder, but they just have the fabric all the way down covering your belly up, which can help you feel a little bit more covered or modest, whatever the case might be. And then cover-ups, they sell a lot of different cover-ups, some that are really handy with like a firmer piece of plastic or wire that you can, you know, kind of holds the cloth, like the cover up away from you, so that if you're helping baby get latched and things, especially in those early days or weeks, you can just kind of peek down and see what's going on. That being said, you don't have to buy anything like that. If you choose to use a cover up at all, you can just use a large, you know, like those muslin 8 blankets, things like that, and tie a knot behind your neck. But like I said, you don't even have to cover up. Once they're a few months old, they kind of get nosy and they don't like to be covered. So then it becomes a distraction because they're patting and flailing at it. And sometimes too, when you get the cover-ups out, it's kind of like lights and sirens, like, hey, she's gonna nurse over there. So I always felt personally that if I could just wear some sort of a zip-up sweater or sweatshirt or cardigan along with the nursing tank, I could be a lot more modest and secretive, if that's the word. Not that I was trying to be secretive, but nobody would even notice I was doing anything, and they felt more comfortable sitting next to me at the table or whatever it might be too. So lots of different options to make it more convenient. You just have to do what's comfortable for you.
So hunger cues. These are going to be really important, and it's going to take a little bit to kind of figure out what your baby's hunger cues are going to be. You're going to be learning together. A lot of times it'll start with what we call rooting, and that's like turning the head towards the breast and sort of making mouth movements that indicate that they're hungry, or kind of bobbing their head towards the breast. That's completely normal. Sucking on their hand, their thumb, their fingers, smacking their lips, some kind of tongue movement like tongue thrusting, and they tend to get a little restless. Those are the first hunger cues that we would like you to see. Once you get to the crying level, it can become really hard to get baby to calm down enough to eat, and what's going to stop them from crying is eating. So you sort of get caught in a vicious circle of crying and trying to calm them down and trying to get them to eat. So if you can catch them on those first 5, you're probably going to have a lot easier time getting baby to latch on and having a really good nursing session.
All right, we are going to demonstrate a couple of positions here, and we'll turn that slide back on so you can see a little bit later, but wait till we get our camera on here. All right. So I've got my little baby here, and I'm just going to kind of demonstrate a few typical positions that we would recommend. So many people assume that when they have baby, the first thing that they're going to do to nurse is they're just going to hold baby like you would typically hold a baby, and that's just how you're going to latch. And we're going to tell you tonight that we're going to kind of change that and throw you for a little bit of a loop, and that's not the way we would recommend starting. And the reason for that is that your breast, you're going to need help supporting your breast, and also baby's going to need help supporting their head. They have no ability at birth to move their head to get it where it needs to be. So we want to always make sure that you're belly to belly, okay? So not flat like this, but always tummy to tummy. And the position that we're going to recommend that you actually start with is something called cross cradle. So what I typically do is put my arm through baby's legs, and then I kind of switch to support baby's head like this. My thumb and my fingers are kind of right behind baby's ears. And then I just take one hand with my breast, kind of in a supported manner, and then I just take baby's head and I kind of touch their bottom lip with onto the nipple, and then as soon as they open their mouth, then I latch them on, okay? You would do your nursing session, and we'll talk about length of all that a little bit later. Maybe do a little bit of a burp, maybe they need a diaper change, then you're gonna switch to the other side, and you're gonna, again, support through the legs, hold behind their ears. Your breast will be held with the other hand, and then you will latch baby on that side. Okay, so cross cradle. Just keep in mind, if you kind of are confused, you're like, how did she do that? Just remember that your arm always has to be, your hand is what's doing the supporting. If you're holding them in the traditional cradle hold, all you have to control here is just the kind of the crook of your elbow, and that's not really helpful in getting baby to where you need them to be. So tummy to tummy, and then always supporting their head and neck, and then your breast with your other hand. So cross cradle is the way that we would suggest you first start. And then after that, there's one that's called the football hold. And this is very similar in that you kind of let baby wrap around your side. You can see their legs out the side. I still have their head very much controlled with my hand. And then I would just slide around the side and then hold the breast here, tickle their lip, and then latch them on. And this is a good position for moms, either of multiples, because you can do 2 at once. Yes, it's possible. Or if you've had a C-section, sometimes moms are a little bit more cautious of their incision site being sore or tender, and that keeps baby off of that for a few weeks until that feels better. It's not a bad idea once you've established, you know, one of the positions even to try out another position. Different positions can empty out different parts of your breast differently or more efficiently. And so by switching positions, it can help make sure that you're not getting those clogged ducts and things like that because everything is getting empty. So once you've established either that football side hold or the cross cradle, baby's now maybe 4 or 5 months old and they've got some control of their head and neck, then by all means go ahead and just do that normal cradle hold. Okay. There is one more hold that we have listed on the PowerPoint. It's called the sideline. And basically that position is one for, I would say, older babies, you know, maybe not quite toddlers, but older babies that can lay next to you, you know, maybe early in the morning when you're just having some snuggle time before you get out of bed. But baby probably will need to be propped up a little bit. Again, depending on mom's anatomy and the size of your breast, it might be comfortable this way, it might not be, but sometimes it's a nice kind of relaxing way to start the morning, letting baby nurse a little bit and you can still get a little bit of rest. So you can look that one up more if you like, but typically that's one for later on down the road. So, and there's that position there. There we go.
All right, go on to the next slide. So latching baby correctly is so very important. It's important for mom's comfort, for your milk supply, using, getting baby positioned right so that you're comfortable and that baby gets that good deep latch to stimulate those milk ducts to let down the milk. Use pillows to position the baby. If you are all hunched over, you're going to be uncomfortable. Baby's going to probably get a little uncomfortable and it can lead to some problems later. So use lots of pillows to get baby propped up and make sure that you're in a good position to nurse baby. Check lips and tongue position. I think the next slide will show kind of a diagram of how that's all going to look, but we want the lips flanged out, the tongue underneath the nipple of the breast. That usually gets a really good deep latch if you can do those things. Avoid pulling on the nipple, especially when babies are older. If somebody walks into a room while they're nursing, they tend to not let go and kind of turn their heads and pull. It can be very uncomfortable, or if they don't get enough of the breast in their mouth, it can be very pinchy. So we would like you to break that latch when it's painful and just sticking like your pinky finger in the corner of their mouth and breaking that suction. If you just try to pull them off, it's going to be very uncomfortable. So break the suction first before you just pull them off. And there's the diagram about getting a good latch. If you notice, you kind of tilt the nipple up towards the ceiling a little bit and have the baby's bottom lip and tongue underneath, like the areola and the nipple. And then when they start to show an interest, you kind of just lower the breast into their mouth. And that helps get that, get your nipple to the roof of their mouth, gets a lot of the nipple and the areola into their mouth, and usually they'll get a nice deep latch this way and good suction and great milk production for you and baby.
So a typical feeding can vary depending on the baby and the mom and the situation, but here are some things we want you to consider. So looking for those hunger cues. Shar talked about those a little bit earlier, and you know, the smacking of their lips and sucking on their hands and all those things, and making sure that you're getting to baby if possible before that restless and crying period. Once you have baby and you're ready to do the feeding, try and latch them onto your fullest side. Now you might be thinking, how will I know that? At first, you will be able to tell just because of likely you'll be fuller on one side because your milk hasn't kind of figured out how much baby needs yet. Sometimes just a quick press on the top of your breast, you'll be able to tell if it's firmer or not. That being said, it's not the end of the world if you just pick one, but try to do every other so that you're doing it evenly. Some people will use a trick of like, like a hair binder around their wrist. They'll put it to the wrist that they ended on so that the next feeding they know to start on that side. At any rate, start on the fullest side, do your full feeding, try to make sure baby is doing at least 10 minutes of active sucking. Sometimes baby will fall asleep and they'll do a real short, quick suck, which is mostly like pacifying. And we want to make sure that they've got an actual swallow happening. That's an active milk transfer happening for at least 10 minutes. Burp your baby, and then you're going to offer the second side. Sometimes baby will refuse the second side. Sometimes they'll take the side for 2 minutes. Sometimes they'll nurse for 5 to 10 or 20 minutes. There's just really no way to know. They'll eat until they're done, and when they unlatch, you trust that they're finished, as long as they have actively sucked for that 10 to 45 minutes. Now, at the beginning, it will be that 45 minutes, likely, maybe longer, and then after a couple of months, it will be that 10 to 15 minutes. They do get a lot more efficient. And then we want to make sure that you're feeding on demand. So whenever baby is showing those hunger cues, they are put to the breast. We want to avoid watching the clock and limiting them on feedings because it hasn't been long enough between feedings. If baby is showing those cues, there's a reason for that. So we want to make sure that we're putting them to the breast and listening to their needs.
So milk production tips. Supply and demand basically comes down to the more baby nurses or the more you pump, the more milk you will make. So we want to make sure you're staying hydrated and trying to keep that supply up that way. Again, listen to baby's hunger cues, feed them on demand. That will help you also increase your supply and keep that supply up. If you're going to supplement or use a bottle feeding in place of a nursing session, that will probably decrease your supply, especially in the early weeks. So be very cautious of that at first. Again, watch the baby, not the clock. We want you to, again, feed on demand. If they're showing those hunger cues, go ahead and start a nursing session. And then at first, go everywhere with your baby. They usually take 45 minutes to eat in those first month or so, and they're gonna be hungry about every couple of hours, 2 to 3 hours. So they're gonna be eating about every hour and a half. By the time you're done nursing, you get about an hour and a half before they're gonna wanna start again. So keep that in mind. It's just easier to go everywhere with your baby.
So a question that everyone always wonders is, if baby is getting enough. And unfortunately, our breast doesn't have any ounce markers on it, right? But there are a few things that can kind of give you some good hints. So for baby, if baby is nursing, again, actively nursing, not just pacifying, but we're hearing those clicks, those swallows for at least 10 minutes, if not even longer would be better. That they're nursing 8 to 12 times in 24 hours. So even throughout the night, we want them waking and eating every 2 to 3 hours. 6 to 8 wet diapers, 3 to 4 poopy diapers in that 24-hour period. So lots and lots of diapers. Some things for mom, I kind of covered these. You'll hear the swallowing. I remember with my first child 10 years ago, the lactation nurse was in there and she's like, "Do you hear that? Do you hear that click?" And I was like, yeah, I hear that click. And I really had no idea what she was talking about. But once my milk came in, once I was home, that click became more distinguished to me and I understood then what she was talking about. So you might not understand what you're listening for at first, but it will come. So you'll hear that swallowing, you'll hear the gulping of baby. You'll be able to tell when your breasts are emptying and they'll feel softer. You'll be changing a lot of wet diapers, a lot of poopy diapers. And if you are concerned still, you can do something called a weighted feed. Lactation does those, and that would involve you coming to lactation, them weighing baby naked, and then you nursing and then weighing baby again, and they could tell down to the grams how much baby is eating. One kind of caveat to that is just it's really important to do multiple weighted feeds before you would kind of trust what it's telling you, so to speak, because it doesn't take into account the rest of the day or what's happened previously. So, if baby was fussy that morning and you fed them just a little bit to top them off because you're like, man, I don't want them screaming in the car all the way to the hospital to lactation appointment. I'm just going to give them a little bit of a snack, not thinking that when you get there, they're going to weigh them and feed and weigh. And now you don't know that, okay, well, they only maybe took an ounce, not remembering that they took maybe 3 or 2 half an hour prior because of that little snack at home. So make sure you do multiple weighted feeds to really get a good picture of how things are looking. But again, that is really a last resort. If you are noticing all those other things, trust yourself, trust your body, that baby is doing just fine.
So what can be done if it hurts? We would love to say that breastfeeding is a great experience and you're not going to have any difficulties, but more often than not, you are going to hit some bumps in the road. And one of the first things you might notice is your breasts aren't used to that much active stimulation on a regular basis. So your nipples can dry out a little bit. They can get a little cracked. You might have a little bit of bleeding. If that's the case, you can buy what's called lanolin. It comes in a tube. You find it in the baby section. You can find it at any of the major stores, pharmacies in our area. And you just squirt a little bit out of the tube and rub it around your nipple and your areola. And if you put it on and about a half an hour later, baby all of a sudden gets hungry, it is edible. So baby could ingest a little bit of it and it's not going to harm baby at all. You can also use what they call soothies. They do have these in the hospital. They're just little gel pads that you put in your refrigerator. They get cold. And if you're having some discomfort, you can just kind of peel them off the backing and stick it to your breast and wait till they get, room temperature, but that cold can feel really good. If you're sore and, uncomfortable, breast milk has all that wonderful goodness for baby, but it also has some antibodies and some other properties that can help with healing. So you could express a little breast milk, gently massage it around your nipple and areola and let it air dry and then see how that helps. That can be a big thing. The last thing is always, always, always check latch and position, making sure baby's lips are flanged out, that their tongue is underneath the nipple, that they're getting a lot of the nipple and areola in their mouth, that they're belly to belly with mom, that they're up, up to mom's level and not kind of down in her lap area as much. We want them up high and kind of parallel or horizontal with the breast. So check latch and position, that's really important.
Now, Shar just mentioned some of the typical like day-to-day things that are uncomfortable, but there are some times when we would recommend you call your provider, and that would be if you experience some of these things. So when we say pain, that's different than like discomfort. A lot of ladies will find that it's uncomfortable when baby first latches on, and then once the milk once baby starts transferring milk and they're done kind of massaging those ducts, the milk starts transferring, then a lot of times that discomfort will kind of cease for a while or cease for that feeding until you latch again, because it's that stimulation that's the uncomfortable part. But if you're experiencing pain, like toe curling pain that doesn't stop for the entire feeding, or if you're not feeding and you're still having pain in your breast, then we want you to call your provider. If your nipples are bleeding, if you have flu-like symptoms and fevers, that would probably be an indication of something called mastitis, which is where you have an infection in one of your milk ducts. The milk is still safe for baby, and in fact, the best way to clear that is to clear that milk out. So by letting baby nurse a lot on that side would be helpful. It is uncomfortable. The good thing about a mastitis diagnosis, if you will, is that it's really treatable. Usually you can just call your provider and remind them that you're breastfeeding, and they will be able to call in some sort of a prescription or see you and make sure things are fine. And within 24 hours or so, you should be feeling a lot better. And then lastly, frustration. If you're getting to the point where you just aren't feeling like you're being successful, or baby's just not taking to it like you thought they should, or something's hard for you, make sure that you're reaching out to someone. It might just be that you need a break. It might be that you just need some words of encouragement. Reach out to friends who have had a successful breastfeeding journey, and maybe their conversations with you can be enough to kind of get you over that hump in the road. So it's okay to reach out for some help if you need it.
So you're going to be feeding your baby during the night, probably for many, many months, and you're going to want your sleep. So things to help with that is utilizing a co-sleeper or bassinet, or putting the crib in the room in your bedroom, or a pack and play, something like that, to have that baby rooming in with you, so you're not having to get up, walk down a hallway or down a flight of stairs to get, baby when they're hungry and wanting to eat in the middle of the night. Nap when baby naps. It's kind of hard for some of you. It was hard for me. When baby would nap, that's the time where I'm like, oh, I could catch up on dishes, or I could catch up on the laundry, or, bills or something like that. We strongly encourage you to nap when the baby naps, especially in those first couple of months. You are recovering from having a baby at some medical event in your life, and we really want you to get the rest that you need to recover and get back to normal. Feeding more during the day can mean that you could feed less at night. This usually holds true when babies are about past that 6-month age. That can happen. They eat about 8 to 12 times in a 24-hour period. If you can get most of those feedings during the day, they tend to eat less at night. Have partner give baby a bottle once nursing is well established, to give mom a break, or maybe a babysitter so that you can get a night out to kind of get a break from baby. That's perfectly fine. But again, waiting till after they're about 3 to 4 weeks old is really recommended. And if you do give baby a bottle, really you should pump at least for a little bit during that time so that your supply stays up. And then establish an overnight routine utilizing both partners or whoever happens to be living in the house as much as possible. Maybe one of you gets up with baby and changes baby's diaper, and then brings baby to mom, and mom feeds baby and then puts baby back to bed. Whatever it takes to get kind of both of you involved in the process, then one person isn't completely wide awake and struggles to get back to sleep, then you've kind of got 2 half asleep people doing the job, which is okay, because then it kind of gives everybody a little bit of a break.
So we're going to talk just a little bit about breast pumps. Just keep in mind that not everyone will need a breast pump. If you are planning to be home with baby for a good chunk of time and not returning back to work, you could get by with maybe even just like a single hand pump, just to express enough for an occasional bottle. But if you're going back to work, you're going to want to look into some options. There are many, many different kinds. There are some that are, hand powered. There are some that are electric, single, double, so you could pump both sides at once. There are some that are hands free, which would be like, many of those are just like a bra with spots where that holds the bottles to your breast basically while it's pumping. But there are other ones that now are very discreet and slide into your bra, and it pumps very quietly and discreetly while you're still doing your job. So look into all the different options, talk with your friends and people who have recently done that, and see what worked best for your needs. And then once you choose something, make sure you read the manual to make sure that you're using your pump the most efficient way you can.
So these are just the basics of pumping. We want you to always feed your baby first and then pump. So we want baby to get all the milk and all the nutrients that they need, and then start pumping after that. Your body will start to make more milk at that time. So don't worry about, baby kind of eating it all. Your body will get used to that and just continue to make more milk to accommodate both. There usually is most milk in the morning. It has to do with some hormonal shifts that happen while you sleep. So usually that first time in the morning, feed baby and then pump maybe before you go to work. You might get more milk at that time than any other time. You're going to need to pump or express as many times as you would breastfeed baby while you're away from baby. So if you know that you're going to be gone for, say, 8 hours during the day, and baby's going to eat 3 times during that time frame, you're going to need to pump 3 times during your work day. So kind of keep that in mind as you're going back to work and talking to your supervisors or whoever to get that schedule figured out so that you get enough pumping time. Once you pick up baby from daycare, breastfeed right away. They are the most efficient way to transfer milk. So that will also help keep your supply up because your body will start to make more milk at that time, which then kind of keeps the supply up for the other times where you're away from baby. We're going to talk about a couple of things. So we're going to switch to a live view. The first thing we're going to talk about is a silicone milk collector. A lot of people call these a haka. It's just a silicone bottle with kind of it's squishy and soft. Kind of the easiest way to attach it to your breast is to squeeze it so it kind of flanges out like that. Rest it up against your breast and then just sort of let go, and that suction usually, oh, there it goes, attaches, see? And so while you're nursing baby on one side, you can attach this to the other side and collect the milk that maybe would be leaking out into a breast pad. You could have it collect into here instead. It's not exactly a pump. It doesn't have any kind of sucking action. It just collects what leaks out. As your breast gets softer on this side, notice how it fell off. That's very common. You might need to quit at that point and just kind of set it down. I recommend you can buy ones that come with a little stand or keeping a cup on hand to set it in because they're pretty tippy. So we don't want you to have them tip over and lose all the milk you just collected. The other way you can do it to get it attached is you can kind of flare it out like this, hold it, squeeze it, and then just kind of flip at the same time.
That's what I always found was
Yeah.
easiest.
Yeah.
Was to do that. Put a little more suction on and pull a little bit more milk out.
So you have a couple of options for the haka. The next slide, we're going to talk about storing milk. This is a milk storage bag. You can get them anywhere, all different brands, kinds, totally up to you. The biggest thing that you want to remember when you're buying them is making sure they have ounce markers on them so you know how much is in the bag, and that it has a label up here at the top so you can write the date that you collected the milk, baby's name, maybe the time you collected it. You could put little notes on here like, oh, I had a Mountain Dew right before I pumped this milk, so it's maybe caffeinated a little bit. You might not want to feed baby this bag of milk at bedtime. But that becomes really important so that you know how old the milk is in your freezer, and also for childcare purposes so that they know who this belongs to. All right, so very important that you label everything as you're pumping it so that you remember, a couple of months down the road, how old it is and when you did it. All right.
All right.
All right. Next.
All right, so we've talked about pumping milk. Now a little bit about how do you store that milk once it's pumped. So we want to make sure that when we're pumping our milk, we're getting it in the refrigerator and to the same temperature before we would mix it with any other milk. So the top point there says avoid adding freshly pumped milk to already cooled milk. And that doesn't mean that later you can't dump them together for freezing purposes, but we don't want to mix warm, fresh milk with cooled milk. So get it all the same temperature in the back of the fridge and then go ahead and do your freezing session. We want to freeze milk in small portions, so either in little bottles or better yet, those bags that Char just showed. They freeze beautifully, nice and small and compact. Once they're frozen, you can stand them up and you can freeze them or stand them up and kind of line them up in like a shoebox size container and keep them in order with oldest to newest, things like that. They thaw really quickly when they're in those little bags like that as well. We want to make sure you do small portions also. They thaw quickly and just so you don't waste. Once it's been warmed and thawed, it can't be refrozen. It needs to be used quickly. So if you freeze a great big 6-ounce bag and baby drinks 2 ounces, you're kind of limited on how much time you have to use that milk. So do small portions and you can always thaw another bag. Like Char said, make sure you're always labeling those containers with the date and baby's name and using your oldest milk first.
This is just a simple chart about storing your milk. So breast milk can be stored at room temperature, like on your kitchen counter, for about 4 to 6 hours. We usually say, err on the side of caution and do 4 hours. And this is in like your typical average temperature house. If it's really hot in your house, you probably want to get it in the fridge a lot sooner than that. If you're at work and pumping and you don't really have access to a refrigerator of any kind, you can put them in those little cooler bags with the frozen, blue ice packs. And you can put it in one of those, and it keeps its temperature for about 24 hours. So that gives you a little bit of time to pump at work and then get home. In your refrigerator, it can keep for about 3 to 8 days. And in your freezer, if it's like a top bottom freezer, side by side refrigerator freezer, something like that, it's about 3 to 6 months. And anytime you're putting it in your refrigerator or that kind of a freezer, we want you to put it as far back into the unit as possible. If you keep it in the door, every time you open the door, room temperature air hits that milk and it shortens the time that it can keep in that refrigerator or freezer. The freezer listed up here, 6 to 12 months, that's like your big chest freezer that you might keep out in your garage or your basement. So it'll keep a lot longer in those, basically because you don't open them as often. So they stay colder longer.
When we are wanting to thaw milk, we're going to want to make sure that we do that in the original container. You can thaw overnight in the refrigerator, or you can just hold it under warm water. Whenever you are thawing breast milk, I always recommend people to put those bags in some sort of a container or a tray, because it's very common that they get a little nick or a little hole in the corner of the bag, and the last thing you want is to come out in the morning and your bag of milk is now empty and the milk has dripped all over your fridge. It's a mess and a waste of that good milk. So have it in something so that you can catch the milk. Making sure that you're never using a microwave or that really hot boiling water. Your breast milk has living cells in it. We want to make sure we preserve those as much as possible for babies. So using that warm water is going to be key. Once you've thawed the milk, use it within 24 hours and don't ever refreeze it.
So paste bottle feeding is a good way for caregivers who are giving baby a bottle to allow baby to mimic breastfeeding as much as possible. It avoids wasting the milk, and it usually makes it easier for baby to accept the bottle. You can go on YouTube. There's lots of videos that explain exactly what paste bottle feeding is, but the basics of it are you hold baby in a more upright position so that they have control of the flow. Alternating sides halfway through a feeding, just like you would with breastfeeding. You're offering one breast and then burping them and then offering the other side. Mimic that when you're bottle feeding. Using a slow flow nipple is very helpful. Bottles tend to kind of just drip the milk out of the nipple because there's that hole there, so they don't, it doesn't take a lot to get the milk out of a bottle. So if you use a slow flow nipple, it causes baby to have to work a little bit to get the milk out, just like they would if they were breastfeeding. You're probably going to have to burp baby a little bit more often when you're bottle feeding because there's air in bottles. There's not really any air in your breasts, so babies tend not to be as gassy when they're breastfed. But bottle feeding, you're probably going to have to burp them a little bit more. Again, watch for those feeding cues and pay attention to when they're hungry and allow them to kind of control everything with the bottle. And then use this time to bond with baby. That's kind of our code for, we really don't ever want you to prop a bottle. It can cause baby to choke. It's not really safe. You're not paying attention to their hunger cues. So when they're full, that milk just kind of drips out of their mouth. And so you're kind of wasting the milk. So holding baby, or at least, having baby next to you in an infancy, but you have control over the bottle is key. We don't want you to just prop the bottle and then walk away.
Now that baby is born, there are things that you can kind of introduce and have back. So your Tylenol, ibuprofen, and Sudafed are all safe now. If you eat a variety of foods, it's been found that your baby will actually have a wider palate and hopefully be less picky because your milk does change with the flavor of your foods. We still want to avoiding caffeine and alcohol as much as possible. Small amounts obviously is going to be okay. Now that you're not pregnant anymore. And we want you to consult your doctor, your pharmacist, or lactation with any questions you might have. You know, your doctor or your pharmacist and lactation consultants are going to be probably number one on your list as far as breastfeeding questions because they're the most familiar with medication interactions and things like that with breastfeeding. So always make sure that you're consulting people with your questions.
So common problems in the first 6 weeks. The number one problem is not nursing enough. That can be caused by, you know, allowing baby maybe to sleep a little bit longer just because you think they're, you know, you're excited that they're sleeping longer, but sometimes that's not always a good thing. We want them still eating about every 3 to 4 hours in those first few weeks. We need them to get back up to their birth weight and then consistently gaining weight. Feeding times can be too short, so maybe increase that nursing session a little bit, getting closer to that 45-minute mark, and again, watching for that active swallowing and not, you know, a sleepy baby that hasn't done a whole lot. They just kind of suck a little bit, but there's not that active transfer of milk. Overuse of bottles and pacifiers. That can cause nipple confusion. It can also make babies a little bit of what we call a lazy eater. It's a lot easier to get the milk out of a bottle than it is out of the breasts. So they have to work a little bit harder when they're breastfeeding. So we want you to offer the breast as much as possible. Poor latch. Again, if you are having concerns with your latch, make an appointment with lactation and they will walk you through that and kind of help you figure out what's going on and correct it. And then sometimes just associating normal newborn problems with breastfeeding problems. Not everything that comes up with a baby has to do with eating, and not just breastfeeding, but even just, you know, formula. Some babies are just a little fussy, just a little crabby, and no amount of anything is really going to fix that problem. They're showing their personality at a very young age. So it doesn't always go back to a feeding problem. Sometimes it's just, unfortunately, your child's personality. So kind of keep that in mind too. Most of the time it's just a phase, you'll get past it. The first 6 weeks is probably the hardest because mom's recovering after having a baby and getting to know that baby. So figuring each other out, you know, can take a little bit.
Most of all, we want you to find support during this journey. We want to make sure that you're feeling comfortable and supported, whether that's reaching out to friends and family. Again, those who have had successful breastfeeding journeys, as they are going to be the most likely to be encouraging for you. Lactation consultants are always great. Keep in mind that they're resources to be used not just in the hospital, not just when baby's 3 days old, but even further down the road when you're going back to work and you have questions about that, or when you're weaning, or just transitioning to some supplementing, whether that's formula or foods. Anytime there's a change happening with your nursing journey, they're a great resource. La Leche League is an excellent resource. You can find them online or on their Facebook page. It's Mankato St. Peter La Leche League. Hopefully soon they'll be able to resume in-person meetings, but right now their page on Facebook is very, very active. Their leader is great at reaching out to you and checking in again if you have questions and seeing how things are going. So reach out to the Leche League if you have questions. And then as far as online resources go, we just like to remind people to find reputable sources. There are a lot of mommy blogs and things out there that are fun to read, but they don't necessarily offer good guidelines or good habits to follow. So just making sure that you're finding things that are credible resources so that you can be on the right journey from the start.
Trust your body, trust your baby. It can take 6 weeks or more to really get the hang of breastfeeding. So you're going to need to be patient with yourself, with others, with your baby. Support is key, not just all the support we just listed before, but partner, you're going to play a huge role in mom and baby's successful breastfeeding journey. So that support is key. know that every feeding is a gift of love. Whether you breastfeed just in the hospital and then decide, ooh, this isn't going well, this isn't for me, that's okay. You tried it, that's all we can ask. It's all good. So whether you breastfeed for a few days or a few months or even a few years, it's all for the benefit of your baby. And then try to relax a little bit and enjoy baby, especially in between feedings. You know, talk to baby, read to baby, snuggle, cuddle, do all the things that you would like to do with your baby and try to step back from the work of feeding and enjoy that baby.
And lastly, a little quote here. A newborn baby has only 3 demands. They are warmth from the arms of its mother, food from her breast, and security in the knowledge of her presence. Breastfeeding satisfies all 3.